All right, so the region that we refer to as our gluteal region, it's a region that extends from the iliac crest in this region, where you can palpate for your iliac crest on the hip bone, to the gluteal folds here. Right? That's what we call the gluteal region. And externally, it's characterized by the presence of the two buttocks with an intergluteal cleft in between the one. Right? So these are what we call surface landmarks. You have the iliac crest, you can feel it from the surface. You can see the gluteal folds, these ones. Your gluteal folds is just a skin crease that is transverse. So you have a transverse skin crease in this region, right? Then there is the natal cleft there, right? So what we are referring to as the intergluteal cleft is what we call the natal cleft, depending on books, whatever book that you guys use. Right. But I will not dwell much on the surface anatomy. There's a lot of surface anatomy for gluteal region, but I'll stick to the muscles, the neurovascular bundle, and the clinicals, right? And important landmarks, right? So once you reflect the skin during your dissections, if you remove the skin, the next thing that you meet is superficial fascia, just like any other region. After superficial fascia, you expect to have deep fascia, right? So what is in the superficial fascia? In superficial fascia, you find cutaneous nerves for the skin. You also find cutaneous blood vessels, so there are cutaneous veins. There are also cutaneous arteries, right? So to make life easy for you, I'll divide the gluteal region. So let's use one side. I'll divide it into 4 quadrants. Can you see the yellow drawing that I'm putting and the numbers? 1, 2, 3, 4. Right. It will be the same on the other side again. So each buttock, you divide into 4 quadrants. There's going to be an upper lateral, which is number 2, upper medial, number 1, lower medial, number 3, lower lateral, number 4. So each quadrant is going to have its cutaneous innervation. So I'll assume you guys have just done upper limb and the brain. So some of the nerves that I'm going to mention, you may not know where they're coming from. Some of them you cover them in thorax, some you cover in abdomen, pelvis. Some of them will meet them in the lower limb. Right? So I'll start with the lower 2 of these ones, number 3 and number 4. They're the easiest. Right? If you look at number 3, it is closer to the posterior aspect of the thigh where I've put an X. So nerve innervation for quadrant number 3, which is the lower medial, it's posterior cutaneous nerve of the thigh. Right. Makes sense to say it's closer to the posterior aspect of the thigh. Look at quadrant number 4. It's closer to the lateral aspect of the thigh. So that quadrant will be innervated by a nerve that we'll call lateral cutaneous nerve of the thigh. Those nerves will make sense when I do the thigh with you shortly. Right, so lower medial, it's posterior cutaneous nerve of the thigh. Lower lateral, it's the lateral cutaneous nerve of the thigh. The upper medial quadrant, which is labeled number 1, that is the only one innervated by posterior rami. So remember the anatomy of a spinal nerve leaving your spinal cord. The very short spinal nerve divides into an anterior rami and a posterior rami. And remember I told you that anterior rami, they innervate the limbs, which is the upper limb, the lower limb, and the ventral body wall. posterior rami innervate the dorsal body wall. Right. So this quadrant number 1, which is the upper medial quadrant, it's innervated by posterior rami of the upper 3 lumbar nerves and the upper 3 sacral nerves. So upper 3 lumbar and upper 3 sacral nerves. Then this quadrant number 2, the one that is left, which is upper lateral. Just remember it is innervated by 2 nerves. There is subcostal, which is T12. Then there is iliohypogastric, which comes from L1. We'll do that one when we do the abdomen. So iliohypogastric and T12, which is subcostal. So if we ever do abdomen and I don't tell you the difference between iliohypogastric and a nerve called ilioinguinal, please remind me. The difference that I'll explain at that time will explain why iliohypogastric comes to this region. But it requires us to do thorax first, then we describe an intercostal nerve and its branches. Then we relate iliohypogastric and ilioinguinal to those and say what is different about them. That is what will explain why iliohypogastric comes to the upper lateral quadrant. Then, okay, right. Then, so we have skin. Then after skin, we talked about superficial fascia. The superficial fascia, we say the cutaneous nerves, cutaneous blood vessels, and cutaneous lymph vessels. Right. After that, we meet deep fascia. Right. So the deep fascia of the gluteal region, superiorly, it attaches onto this iliac crest. Right. And it also attaches onto the sacrum. Sacrum is part of your vertebral column. If you remember the anatomy of the spinal cord when we touch the vertebral column, right? So it attaches onto this iliac crest, and it also attaches posteriorly to attach onto the sacrum, right? Then this deep fascia also encloses some muscles, right? So let's skip that a bit. So we go to the muscles first. So does anyone know the number of muscles that we have in the gluteal region? Anyone wants to hazard a guess?
Three.
Three. Which ones?
Gluteus, maximus, minimus, and medius.
Is that what whoever taught you said?
It's a guess.
So we have 10 muscles in the gluteal region. 4 of them are superficial, then 6 are deep. Right. So the 4 superficial muscles include the 3 that you have mentioned: gluteus maximus, gluteus medius, gluteus minimus. Then the 4th one, we call it the tensor fascia lata. So we have 4 superficial muscles in the gluteal region. That is gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia lata. The rest of the muscles that I'll mention in this session, they're going to be the deeper muscles. And what's unique about the deep muscles of the gluteal region, they are called lateral rotators of the hip as a group because they laterally rotate the hip. So whatever muscle that I'm going to put in the deep group, Function-wise, we're just going to say lateral rotation of the hip. Right. So let's start with the superficial. So this is gluteus maximus here, right? I'm sure people know much about it. It's large. It's actually the largest muscle in the body. So if you don't want to miss things, everything that is large or strong or tough or longest or whatever is in the lower limb, with the exception of the hardest fascia, which you remember when you did the neck, it's the temporal fascia. Right. So gluteus maximus, it's the largest muscle in the body. It's also the most fasciculated muscle. I think you can see here. Right. And it covers the entire gluteal region except this corner here. Right. This anterior superior part, it doesn't cover it. Right. So, do you guys want me to tell you origin and insertion?
Yes.
Okay. All right. So you see this picture, right? The bone here. This is what we call the gluteal surface of the hip bone, the outside of it. So I think you can see that. Can you see the is that brown? These brown lines between the red, between the bigger reds, these brown lines here. Can you guys see them?
Yeah.
Okay. We call those lines gluteal lines. So there's a gluteal line here, which we call the posterior gluteal line. There's a gluteal line here, which we call the anterior gluteal line. Then there's a gluteal line here below, which is a bit below here, which we call inferior gluteal line. So the origin for gluteus maximus, as you can see here, it is posterior to this posterior gluteal line. Or let's just say it originates behind the posterior gluteal line. Gluteus medius originates between posterior gluteal line and anterior gluteal line. Gluteus minimus originates between anterior gluteal line and inferior gluteal line. Can you see how systematic I'm trying to be? These muscles will have more than one origin. They will have 6 origins. But right now I've given you one. But that one, it's covering everything. It's the posterior surface. It's the or let's just say the gluteal surface of the hip bone. Right. Maximus behind posterior gluteal line. Medius between posterior and anterior. Then minimus, it's between anterior gluteal line and inferior gluteal line. Right. Then you can also see from this picture that gluteus maximus originates from these ligaments here. You may not know the ligaments as of now because you haven't done pelvis, but we call them sacrotuberous ligaments. I'll talk about them shortly when we do the sciatic foramen. Right. Then it also originates from the sacrum, also attaches onto a muscle on the back of the spine, which we call erector spinae. Right. All those, they are minor origins. Right. Where does the gluteus maximus insert? Hello? I've just scrolled up for you guys to see the answer. Do you think it inserts into one place, or you divide it into 3/4 and a quarter? 3/4 inserts somewhere, the quarter inserts somewhere. or maybe I'm being a bit forward. Do you guys know the femur? The longest bone in the body, which connects the hip joint to the knee joint. Do you guys know the femur, or at least seen a femur before?
Yeah.
Okay. Have you seen a gluteal tubercle on the femur? Gluteal, it's a tuberosity, rather. It's not a tubercle. Have you guys seen a gluteal tuberosity before? Come on. I'm heartbroken, but anyway. Gluteus maximus, 1/4 of it inserts into the gluteal tubercle. Then the 3/4, the main part of the muscle, inserts into this band that we're seeing here. We call this band the iliotibial tract. It's a thickening of deep fascia. We'll talk about it in the thigh. This iliotibial tract, can you see where it goes all the way down here to the knee? So you have a muscle in the buttock that inserts into a tract that goes all the way to the knee. So don't be surprised when you see that the gluteus maximus will also have a function on the knee joint. Right? So when I do the thigh with you, I'm going to introduce a rule that is not an anatomical rule, but a learning rule. If a muscle crosses the hip and the knee, if it is flexing at the hip, it will extend at the knee. If it is extending at the hip, it will do the opposite at the knee, which is flexion. But there are two muscles which do not obey this rule of mine. One of them is this gluteus maximus. Gluteus maximus will cause an action at both the hip and the knee, but the action is going to be the same. It is going to extend. So gluteus maximus extends the hip, it extends the knee. The other exception that I'll give you is the sartorius, a muscle on the anterior thigh, which happens to be the longest muscle in the body. So that muscle will flex both the hip and the knee. But in general, I said a muscle, if it flexes the hip, it will extend the knee. If it extends the hip, it will flex the knee. It will be the opposite. But there are those two exceptions. This is not a rule cast in stone, but this is a rule for learning. It makes it easy for us to remember things. Then innervation. So those who don't go to class, there is a nerve called superior gluteal, and there's a nerve called inferior gluteal. So common sense would tell someone that gluteus maximus would be innervated by superior gluteal, but that's not the case. Gluteus maximus is innervated by inferior gluteal. Right. Then the gluteus medius and the gluteus minimus, they're the ones that are innervated by superior gluteal nerve. Right. Does anyone know the clinical correlate that is associated with injuring your superior gluteal nerve? What do we call the sign? Have you ever heard of a positive Trendelenburg sign? You can look up you can look it up, something called a positive Trendelenburg sign. So one of the functions, or so medius and minimus, they have the same functions. One of those functions is they prevent the pelvis from sagging or sinking on the opposite side. Imagine you are walking. There has to be something, because if you lift your leg on one side, what's going to happen to contents in the pelvis on the other side? They don't have to sink inward. Right? If you get the physics, if you're lifting one leg, that means things can sink on the other side, but there has to be something that supports those things to not sink. And what supports those things is the gluteus medius and the gluteus minimus. So if those muscles are not working, the pelvis will sink on that side and they get a positive Trendelenburg sign. They walk with a funny gait because they are trying to prevent lifting their leg from the ground because it's so uncomfortable if they don't support the contents on the other side. That's a clinical function that I've told you. The other function that is anatomical for gluteus medius and minimus is they do abduction. AB, not ADD. AB, abduction of the hip. I'll tell you of the adductors because they're in the thigh, in the medial compartment of the thigh. But gluteus medius and minimus, they do abduction. Innervation, they are both innervated by superior gluteal nerve. Origin, I've already started. Medius originates between posterior gluteal fold and anterior gluteal fold. I used to love lower limbs so much. It's just so simple and things flow. It makes sense. Minimus, it's between anterior gluteal fold and inferior gluteal fold. Of course, there are other origins. Remember, I said it's not only these parts, but these are the main origins. These two muscles, see, I'm describing them together. They have the same insertion again. By same insertion, I mean they insert on the same prominence or on a bone, which is the greater trochanter of the femur, but they will just insert on different surfaces of that greater trochanter of the femur. But they both go to the greater trochanter of the femur. Right. Okay. Then the other muscle that I want to show you. So let me show you these ones. So I've shown you this picture. Let me scroll up. Okay, I don't want this one. Okay. So this was gluteus maximus. Can you see that other muscle there? It's very small. This muscle here, that's the tensor fascia lata. It's a very simple muscle. Tensor means it tenses. Fascia lata means it tenses the fascia lata. The question is, what is fascia lata? Fascia lata is the deep fascia of the thigh. We're going to do the thigh shortly. Fascia lata is the deep fascia of the thigh. Right. So where does this tensor fascia lata insert? It inserts into the iliotibial tract. The tract where, remember I said gluteus maximus, 3/4 of it inserts into that iliotibial tract. Right. Then origin for this tensor fascia lata could be hard for you guys to remember, but just remember that the ilium is what we call spines. Actually, I'm going to talk about spines a lot, even when we do anterior thigh. So let's just talk about it. So ilium has anterior superior and anterior inferior iliac spines. It has the same on the posterior side as well. Posterior superior iliac spine and posterior inferior iliac spine. Right. So this tensor fascia lata, it originates from the anterior superior iliac spine, but forget about it. Right. So then after you remove gluteus maximus, you see gluteus medius, this one. After you remove medius, you see minimus. Right. So remember I said we start with skin, superficial fascia, then deep fascia. The deep fascia encloses the entire gluteus maximus. So that maximus is entirely enclosed in a fascia, but the other two, the medius and the minimus, are not. Right. Those would be some nice MCQ questions or whatever for examinations, I guess. Right. Then shape-wise, the medius, it's described to be like a fin, so it's fin-shaped. You guys, mostly girls, I think girls have seen a fin. The minimus is also like a fin, so the guys can always ask the girls what fins look like. So those are the deep muscles, and the important clinical there to remember is the Trendelenburg sign. Blood supply for this region, it's two arteries that we call the gluteal arteries. So there is superior and inferior gluteal artery. These ones are not specific to say, like we were saying, superior gluteal nerve is for these muscles, so the arteries for this. No, they are just for the region. And we'll talk about anastomosis. There's a cruciate and trochanteric. I think we'll do that later. For now, let's just keep it simple. Right. Okay. And then the deep muscles of the gluteal region. Right. So remember I said the muscles that we're going to call deep in the gluteal region, they're classically grouped as lateral rotators of the hip. Right. This is one of them, the piriformis. So here's how I want you guys to remember. There's a thorax, then there's the abdomen, then there's the pelvis, then there's the lower limb. So whilst we're in the pelvis, we're going to have the hip bone. We're going to have a pelvic diaphragm. It's a muscle that forms a floor in the pelvis. So things that want to leave the pelvis to go below the floor into a region called the perineum, they can't pass through the floor. Imagine you want to connect a cable in the next room. You can't pass through the wall. The next best alternative is to put your cable through the window. It goes outside. Then you put your cable through the window of the next room. It goes inside. Right. So my example, the room that I am in is the pelvis. The next room that I'm going is the perineum. But the outside that I'm talking about is the gluteal region. So things exit the pelvis and they go into the gluteal region using an opening called the greater sciatic foramen. That foramen is where this muscle is passing through, the piriformis muscle. Then the things that have entered the gluteal region, some of them continue into the lower limb. Actually, gluteal region is the first region of the lower limb, so fine. But others, they need to go into the next room, which is the perineum. They will now use an opening that we call the lesser sciatic foramen. If you look at your course outline, it says you need to be able to remember things that pass through the greater and the lesser sciatic foramen. So I'll give you a list, but let's do the muscles first. So the muscles in that region, I think you can see them here. These are the small muscles of the gluteal region, the deep muscles. So there's piriformis, this one. There's gemelli superior. If you're calling it superior, that means there should be an inferior somewhere. So there's also gemelli inferior. Then there is this muscle here that is between them. I think if you would have done pelvis, you'd know that this muscle turns 90 degrees. I think you can even see it here. It's called obturator internus. If you're calling it internus, means it's internal. Somewhere I'll see an externus. So externus, I'll tell you what's unique about it, why it's not being shown on this picture. Then there's this muscle quadratus femoris. So I said piriformis, gemelli superior, obturator internus, gemelli inferior, quadratus femoris. Can you see how they are ordered? Why I didn't mention them haphazardly is innervation for this gemelli superior, it's the same with the muscle just below it, obturator internus. Nerve innervation for this gemelli inferior, it's the same also with the muscle below it, which is quadratus femoris. So there is a way for you to try to make these things make sense. Right. Piriformis has its own nerve supply, that's fine. So remember I said gemelli superior, same innervation with the muscle below it. Gemelli inferior, same innervation with the muscle below it. The nerve is named after the muscle below. For example, the innervation for gemelli superior and obturator internus, it will be nerve 2, obturator internus. The innervation between gemelli inferior and quadratus femoris, it will be nerve 2, quadratus femoris. What's the function of these six muscles? They do lateral rotation of the hip. Remember I said these deep muscles, they are lateral rotators of the hip. Insertion, they all insert onto the greater trochanter of the femur, except one. So of the 6 deep muscles of the gluteal region, they all insert onto the greater trochanter. There is one exception, and that one exception is this quadratus femoris. It inserts, sadly you guys don't know the femur that much, it inserts onto the quadrate tubercle. I'll share a video on the femur. I'm sure I've done a video using an actual femur, and I used to show most of these things. Right. So far, so good, eh?
Yeah.
Yes.
Okay. So remember I said there's a muscle called obturator externus. Does anyone know why it's not included there? Do you think it's in the gluteal region?
No.
So where is it?
Thinking it's in the anterior compartment of the thigh.
No. No, it's not. I would understand someone who says medial. Though they'll still be wrong. So where is the obturator externus? Do you think it's in the medial? Okay, I'll give you a hint. It's either gluteal region or medial thigh. But what's unique about it is where it is found. Remember, I'm grouping these muscles to say this group of muscles have this function. So where it is found, it does not do the functions of the muscles there. It does the functions of the muscles in the other region. Right? Meaning topographically, where you have obturator externus is different from where to function. Right? So what do you think? Do you think it's in the medial thigh or it's
Yeah,
in the
medial.
So it's in the medial thigh, eh? Right.
Yeah.
So topographically, it's in the medial thigh. That's anatomically where it is. But functionally, it will function with these small lateral rotators of the hip. So it is going to do lateral rotation of the hip. Do you get it? I'm going to mention it in the medial thigh, but function-wise, it functions with these 5 other muscles in your um in your deep gluteal region. Right. Okay. So I promised you things that pass through the sciatic foramina. So let's do it this way. There's greater and there's lesser. Each foramen is a muscle. So greater sciatic foramen, the muscle is piriformis. Lesser sciatic foramen, the muscle is obturator internus. Right. Once you have done that, remember my example of things passing through a window and going back to the other window. Everything else that you're going to say passes through the lesser sciatic foramen. Initially, it would have passed through the greater. But it has to pass through the first window, then go through the other window. Makes sense when you're doing pelvis and really looking at pelvis things. You guys, your way of learning is a bit different from how we do it this side, but I'm trying to make it make sense. So the mnemonic for things that pass through the let me just use a mnemonic for you guys to remember. So what's this color? Okay. Oh, am I failing to draw? What's happening? Okay, I think I'm winning. So the mnemonic for things that pass through the lesser sciatic foramen is this one. Pint, P-I-N-T. The T there is the tendon of the obturator internus. Remember I said each foramen has a muscle. So lesser sciatic foramen, there is obturator internus. Then greater sciatic foramen, there is piriformis. The PIN now, this is what I'm saying. When you then look at things that pass through the greater, they are also going to be there. The P, it's a nerve called the pudendal nerve. You do that when you do perineum. Pudendal means genitalia, the genitals. So it'll be going to the genitals. The I, it's the internal pudendal vessels. So there's an internal pudendal artery, and an internal pudendal vein. Right. The N, it's a nerve that innervates this muscle here, the T. So the N is the nerve to the obturator internus, which I remember saying it also innervates the muscle above it, which is gemelli superior. They said gemelli superior and the muscle below it, which is obturator internus, they have the same innervation. And the innervation is nerve to obturator internus. Right. So this pin will also pass through the greater sciatic foramen. Other things passing through the greater sciatic foramen, there's no mnemonic to remember. But when you do pelvis, just remember that all the other branches that are coming from the sacral plexus that need to go to the lower limb. Like the sciatic nerve, we'll do it with the posterior thigh as well as the rest of the lower limb below the knee. Sciatic nerve happens to be the largest nerve in the body. Traveling posterior to it, there's a nerve that we call posterior cutaneous nerve of the thigh. It's self-explanatory. It will go to the posterior thigh skin. But remember, I also said it innervates the gluteal region, the lower medial quadrant. There will also be the gluteal nerves, superior gluteal nerve, inferior gluteal nerve, and the accompanying arteries as well. So I will send you guys a list for things passing through greater and things passing through lesser sciatic foramen, so that there is no need for me to jumble up words of things that you don't know. Right. Okay. 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 So these are the arteries that we have in the gluteal region. So remember I said there is superior gluteal and inferior gluteal. I didn't want to talk about this, but let me just talk about it. There's a heart. The heart gives us the arc of the aorta, which goes down as the thoracic aorta. I'm skipping all the branches that it will give you. Then becomes abdominal aorta. Then at L4, abdominal aorta divides into right common iliac, left common iliac, and the median sacral. The common iliacs divide in the pelvic brim into external iliac and internal iliac. Internal iliac is the artery for the pelvis. External iliac is the artery for the lower limb. It will change name to become femoral. So internal iliac in the pelvis, it divides into an anterior division and a posterior division. That is where we get the gluteal arteries. Posterior division will give me the superior gluteal. Then anterior division will give me the inferior gluteal artery. Right? That's how I end up with these gluteal arteries. I'm just trying to give you guys a picture of how it happens. Right? So these gluteal arteries, they anastomose with other arteries coming from the external iliac. So that if the internal iliac system is blocked, there is flow of blood from the other, which is the external iliac. So there are two anastomosis. There's a cruciate anastomosis, then there's a trochanteric anastomosis. So please remember this. Each anastomosis of those two is 4 arteries. And of the 4 arteries, 3 of them are similar. They only have 1 artery which is different. So I'll tell you the 3 that are similar, then you will tell me the different ones. So the first 2 are these gluteal arteries. So they will both have superior and inferior gluteal arteries. I will not go into the specifics of telling you guys that is the superficial branch of superior gluteal. I think it will be too deep for you. So superior gluteal, inferior gluteal. Then the third one, which is similar, is no, I've actually jumbled it up. The two arteries that are going to be there for both, it's arteries that we call medial circumflex and lateral circumflex femoral. There's medial and there's lateral circumflex femoral. I think you remember the humeral circumflex. Then for the gluteals, we only have inferior gluteal. So inferior gluteal is there on all the 3 anastomoses. So you guys will tell me which one is superior gluteal because it's not there on the 2. Then which one aids an artery that we call first perforating artery. Right. Okay. Then clinically, gluteal region, we must do intramuscular injections. Why is it ideal? There is a large surface area because of the gluteus maximus. Others argue that where we inject is actually where we put where I said gluteus maximus does not cover the entire gluteal region. That's where you have gluteus medius. Whew.